Taoiseach, the shortage of vaccine supply relative to the demand is well known, as are the reasons for it. I've no doubt that if you could source more vaccine, you would. If you could have vaccines manufactured in Ireland, you would. If you could make vaccine yourself, you would. I've no doubt about any of that. But my question is, given that Dr. Mike Ryan talked about the ethical dilemma of giving vaccines to healthy young people when healthcare workers and elderly vulnerable people need it across the world, given that, why are we administering vaccines in Ireland to healthy young people who have an immunity, who have antibodies arising from previous infection, which of course can be proven with an antibodies test? Now, HIQA accepts that there's an immunity for 6 months at least. We don't know that the immunity from vaccines is much longer. It's certainly hoped and expected it will be longer, but you can't say that with certainty no more than you can say with certainty that there's an immunity from having contracted the virus. Now, that's generally accepted. It informs the approach of Israel, which is considered to be a world leader in vaccination, where they afforded certain additional freedoms to people who had been vaccinated or who had an immunity arising from infection and recovery. Likewise, it informs the EU Digital Pass, which, depending on its detail, may prove to be a good thing or a bad thing in facilitating freedom of movement. So why are we using that such a scarce resource that so many people want to give to young, healthy people who are working in a medical setting or just happen to work for an NGO or a body which has frontline workers, even if they're not frontline workers, because unfortunately that scenario is commonplace. And the second thing is, Taoiseach, you informed this Dáil categorically to Dennis Naughton, Deputy Naughton, that there would be no compulsory vaccination in this state. That was never our approach. It was based around bodily autonomy and informed consent. Given that, why are student nurses in Ireland now being told that they have to be vaccinated to go and finish their placements and thereby finish their degrees? And we need these people. And these are nurses who have been on the front line all along, who have put their health and their bodies on the line for this state. Now, many of them are delighted that they're going to be given the vaccine, but there are some who simply don't want it. And you have acknowledged that there will be no compulsory vaccination.
In relation to COVAX and what Dr. Mike Ryan has said more generally, Ireland and indeed the European Union is the strongest contributor to COVAX and is, as we know, given its strong manufacturing capacity in terms of all of the manufacturing sites across Europe, is one of the biggest contributors globally to the distribution of vaccines that are paid for by other countries but manufactured within the European Union's geography. But Europe, funding-wise and policy-wise, is contributing hugely to COVAX, because no one is safe until we are all safe. We take our advice in relation to vaccination policy from the National Immunisation Advisory Committee and from NIFIT. I support that advice, that notwithstanding people having antibodies, I don't think the evidence is strong enough not to vaccinate those who currently have antibodies. The level of antibodies could differ, for example. Some could have a higher level of antibodies than others. So I think the advice is to vaccinate. Now, again, as has been outlined earlier, we want everyone over 70. So we're still predominantly dealing with those more senior in society in age terms. So we want all those over 70 having a first dose by mid-April. Those with underlying conditions of all ages, vaccinated as quickly as we possibly can. And the HSE operationally are going through that fourth cohort, which is challenging in itself in terms of identifying individuals via GPs and so on, and the consultants. In respect to compulsory vaccination, again, I said that there is no mandatory compulsion on people to vaccinate in the country. I think within the health service, there are particular, I would argue, obligations in terms of collective solidarity, in terms of preventing the spread of disease. We know from the last wave that it was quite very, very challenging. The numbers of healthcare workers who got COVID, the number of staff in nursing homes, for example, who got COVID. Now, thankfully, with the vaccines, the impact has been dramatic. The serial testing in nursing homes now, I think, is indicating 0.3%. Like it's just very, very low, which is a very good vindication of the vaccines and their impact on reduced infection, as well as reduced severe illness and mortality. And likewise, in the hospital setting, that has been the case. You know, I do think we have to, for the overall good, do everything we possibly can to prevent the spread of COVID within and to protect people within the hospital setting and within the health setting more generally.
Taoiseach, what you're saying is that notwithstanding the fact that CDC, notwithstanding what HIQA have said, notwithstanding what most scientists around the world agree, that healthcare professionals who have had COVID because of their work, because they've put themselves on the line and recovered and have antibodies, have to take a vaccine to get antibodies that they already have, or be fired at a time we need them most, in circumstances where there are elderly and vulnerable people across this state crying out, who have no immunity.
Thank you, Deputy McNamara.
COVID poses a huge threat, crying out for that self-same vaccine.
Thank you, Deputy. Taoiseach, to conclude, please.
Again, I always defer to the clinical advice on this, but you're aware of reports from Brazil in respect of reinfection, massive reinfection in parts of, well, mainly massive reinfection from people who felt they would be protected from antibodies. So we can't ignore that reality as well. So I prefer the cautious approach, actually, and I think you know, when we said we wanted to vaccinate healthcare workers, by the way, it was warmly received in hospitals. You know, I mean, it was overwhelming. The relief in hospitals, the relief in nursing homes when people were vaccinated could be seen. You know, so I'm not so sure we're talking about a huge cohort of people here, in any event. But so there's two issues. I think there's the compulsory issue and there's the antibody issue. And I think I would err on the side of caution on the antibody question, defer to medical advice, and vaccinate, particularly people working in healthcare settings and frontline healthcare settings in particular. As we're still learning about this virus, we're still learning about new variants and so on.